How are you everybody? I would like to introduce myself, Dr. Noran Osama Ahmed El-Azizi, Assistant Professor of Internal Medicine and Rheumatology. Today I will give you a lecture on how to approach a case with rheumatological disease. By the end of this recorded lecture, students should be able to describe and classify different types of rheumatological diseases. Approach a case of multi-system rheumatological disease. Select appropriate laboratory and radiological tests for diagnosis of rheumatological diseases. How to evaluate a patient with rheumatological disease. Firstly, by taking a full history we can reach about 60 to 70% of the diagnosis. Then by making full examination we can reach about from 80 to 90% of the diagnosis. Then lastly we confirm our diagnosis by investigations. We have to take care of the history as it is very important to reach the final diagnosis. You must take the confidence from your patient to take all the information from him. We start the history by personal history. We ask about name, sex, age, residence, occupation, marital status, and special habitus. Menstrual history in female patients, asking about regularity, duration per cycle, and if she has history of abortions, and if yes, ask about the number of abortions and in which trimester. Contraceptive history if female patient, ask about the method used and the duration of usage. Please try to think why we ask about all this data. And we will discuss in the face-to-face session. The complaint is the last patient's symptom, bring him to the doctor. It is written by patient word and its duration. We start the history of present illness by 3 simple screening questions. 1. Have you any pain or stiffness? 2. Can you dress yourself without any difficulty? 3. Can you walk up and down stairs? History of present illness is divided into 3 categories: articular, extra-articular. Questions related to drugs will be discussed in face-to-face session. Articular manifestations will be discussed in details in the following slides. Extra-articular manifestations, we ask briefly about all the body systems as skin, eye, neuropsychiatric, muscles, cardiopulmonary, GIT, renal, hematological, and constitutional symptoms, by screening questions, and if there is a problem in this system we will take a full history in this system. Please, my dear students, try to collect the screening questions. All extra-articular manifestations and question related to drugs will be discussed in details in face-to-face session and clinical session.